it's going to be time to negotiate health care that's going to be good for everybody. That money is a subsidy for insurance companies. Take a look at their stocks. Look where they are. They're going through the roof. From past, I don't know about today, but the insurance companies have made a fortune. That money was a subsidy and almost, you could say, a payoff to insurance companies. And what we have to do is come up with great health care.
That was President Trump speaking earlier on his stunning decision made last night to end so-called cost-sharing reductions. It was a second attack in 24 hours by the president against the Affordable Care Act. Insurance markets now are going to have a lot of trouble. Let's take a look at what these cost-sharing reductions actually are. They are subsidy payments. The CSR are federal government subsidies to health insurance companies used to offset the out-of-pocket costs for low-income Americans, those who wouldn't have been able to afford those costs. They were negotiated with the insurance companies to have them participate in the exchanges. This year, the payments were going to be $7 billion. Most of those have been made. In 2018, it was set to be about $10 billion. But take a look at this. In August, the Congressional Budget Office issued a report saying that ending the subsidies does not save the federal government any money at all. In fact, because of laws that say that the federal government has to subsidize those low-income insured, it's going to cost the government $194 billion over the next decade. Okay, so let's talk about the immediate effect of ending the subsidies to insurers. Some states announced their 2000 Obamacare premiums with and without cost-sharing reductions. So Pennsylvania, for instance, had nothing changed. Their premiums would have been up about 9%. Now that it's gone, it's going to be 20%. Michigan was 17. Now it's going to be 27. Georgia, 31.5. Now 52. Maryland didn't even calculate. It was going to be so high to start with, they didn't calculate what it would be without it. There are other states that already assumed that the CSRs would not continue. These are these states. So they are assuming that what President Trump just did was going to happen. So look at these increases, 25. So if somebody tells you that the marketplace premiums are not going up, that would be a lie. 25, 31, 36.5, 36.7, 39, 44.7, 48%. Only Alaska's down because Alaska has the highest premiums in the nation in the first place. It announced a decrease, assuming that CSRs would not continue. Already, the attorneys general of New York, California, and Massachusetts say they're going to file lawsuits to prevent President Trump from ending these subsidies. Now, I want to talk more about how these moves are going to have an impact on Americans. Joining me now is Pamela Cipriano. She is the president of the American Nurses Association, which is yet one of the major associations of people who actually have something to do with health care, who have said that this attempt to repeal Obamacare, or in this particular case, to wreck it, is ill-advised. Pamela, thank you for being with us.
Thank you, Alec. Glad to be with you.
Talk to me about why the American Nurses Association thinks that there's another way to go down, another road to go down than the way we're seeing the administration pursue.
Well, we believe that these subsidies, first of all, have been a lifeline to people who could never afford insurance. So this deals a really strong blow to those individuals, because we know that what's going to happen is that some of the insurers are going to continue to leave the market. It may not be for immediately in 2018, but it means down the road it's going to be a very serious concern. And nurses are on the front lines, and we see what happens when people don't have insurance. They forego the preventive care that's covered. They don't seek diagnosis and treatment for serious conditions. They may not be able to get the help that they need to manage their chronic conditions. All of these lead to several things. First of all, poor health. And it also means that a lot of times people exit the workforce. So all of the effects of not being able to access preventive care and illness management care and any kind of emergency care are really detrimental overall to the American people.
So we've had a lot of conversations on this show with the American Cancer Society and the Heart Association, diabetes and Alzheimer's. One of the things about nurses is that you see everybody who is a patient at any level in the system. One would think that in trying to fix health care, and there are a lot of people who think it needs fixing, that there would be consultation with organizations like yours. But in this process, there have not been hearings. What are the kinds of things that you want to tell legislators as they attempt to fix health care?
Well, we've been just as shocked that there have been no hearings and that there's been very little, if any, bipartisan discussion. So we want lawmakers to pay attention to what we think are really important principles in any kind of transformation or health care reform. We believe every single American needs access to quality, affordable health care, and that if they can't afford it, then we need to be able to provide ways to help them. We also know that there needs to be appropriate use of the high-tech, high-cost care, and that's both on the part of organizations and individuals that are providing care as well as consumers. We also think it's really important that we focus more on preventive care and wellness care because, again, that's where we can really see not only a benefit for people but really a benefit for the country as a whole. And we also know it's important to make sure we're supporting an adequate health care workforce. But we want Congress to start bipartisan discussions because this should not be a political football. We should not be using the American people as the pawn in a game. This is not a game to be won or lost. And I think that's really one of the very disappointing behaviors that we're seeing right now.
Well, we hope you and the other health organizations get a chance at some point to testify and to speak to those members of Congress. But until then, you always have a place here on MSNBC. Pamela Cipriano, president of the American Nurses Association, thank you for joining us.
Thank you, Allie. Appreciate it.
All right, coming up.